right, welcome back to another Community Spotlight with Total Sports Therapy. Today we're talking with Dr. Abram Burgher with Advanced Spine and Pain, and we're going to catch up with him, get a little bit more information about him personally, as well as his practice and the patient population he tends to see, and a little bit more information about the type of specialist that he is as well. So, welcome. Thanks for joining us.
Thank you, Drew.
So, let's start a little bit initially with some personal stuff. How long have you been in Arizona, and kind of when brought you here?
Sure. So I'm from Minnesota originally. First came down early 2000s as part of my training with Mayo Clinic. Went back to Minnesota for the rest of my training, and then came down again in 2009. I've been here since. So 13 years. Been here since.
Okay. Yeah. And how long has Advanced Spine and Pain been open?
Advanced Spine and Pain was started by some veteran interventional pain specialists just 2 years ago. All of the pain specialists, however, had been in a previous practice together for many years. You know, it combined, I think we say on our website, it combines something like 150 or 180 years or something. So a number of specialists with a lot of previous experience. We started Advanced Spine and Pain just a couple of years ago, though, during COVID, with some specific goals that, you know, I'm sure we'll get into at some point as we talk a little bit more about that practice. So about 2 years. We cover the entire valley, and we have a number of different sites of service, clinics, surgery centers, and whatnot.
Okay. So when you were in med school, kind of going through some different aspects of different specialties within med school, what kind of drew you to this profession or this track?
Right. So I went into medicine certain I was going to be a small town primary care physician, right? That you know, as you get into medical school and you see all the different specialties, you know, one thing that was really hard for me is actually I liked everything. I liked every specialty. I liked the primary care fields and everything. So it was actually a very difficult choice for me. I spent an extra year even doing rotations to figure out exactly what I wanted to do. I saw anesthesiology, which is my primary specialty, and then a fellowship in interventional pain medicine as a way to really kind of be on the cutting edge of a field that was really growing at the time and still is really growing.
Okay. So help the people that might be watching this video, some patients that might have some questions. You know, another term that the patients tend to know is pain management, interventional pain, PM&R, kind of a lot of lingos going around, and I get a lot of questions from patients as terms of, you know, do I need to see a neurologist? Do I need to see an interventionalist that's also an anesthesiologist? Kind of blend those together, sort of help patients understand.
Yeah, great question, and one that's very difficult to answer because there's a huge variety in terms of what does it mean to see a pain specialist, as you're kind of identifying there, right? Part of that is just the nature of the field is changing dramatically. And it's still relatively new. I mean, the field as a whole really is only 20 to 25 years old as a fellowship-based specialty, which is really young for medicine as a field. And because of that, people have come from all sorts of different backgrounds, and the field is still changing dramatically all the time. I think the most important thing is if you don't have a previous experience as a patient who's seen an interventional pain specialist, is that you go to a place that offers a wide variety of services, right? You go to somebody who's experienced, you go to somebody who has, either, if not surgeons in the practice, they have good connections to surgeons. If not physical therapy or chiropractic care, some sort of physical modality in the practice, they have great connections to that. Behavioral health in the practice, a lot of these patients have, if they don't have significant, you know, anxiety disorders or depression disorders associated with their pain, certainly that can be something that we can use to help them get over some of the chronic natures of pain. But so bottom line is, if you're new to seeing a pain specialist, you want to go to somebody with a legitimate amount of experience who has a relatively big practice with a lot of different things to offer.
Okay. Yeah, it's a good point, because the concern that I'll have a lot of patients ask, that have maybe come to physical therapy from a primary care specialist, and their instruction is, okay, go do some therapy. If that doesn't improve, come back to us and we might have you go see a pain specialist. And then, you know, there's always the stigma that, well, you know, I would say 25% of the patients will tell me, well, I don't want to just go see somebody to take a bunch of medicine. Mm-hmm. You know, and our job as physical therapists is to educate them. There's a lot more options. I mean, it's a very, in my opinion, a very important step in between injury to surgery, if that's ultimately what ends up having to happen. And a lot of patients have some stigmas just from, Dr. Google. So, we try to educate them and, I'll just say, let's say a patient came to you and said, hey, I'm not interested in taking a bunch of medicine. How do you kind of approach that?
Yeah. So, how you help people, as you know, is just different, and it's very patient dependent, right? Our practice is a little bit unique in that we call ourselves a pain management practice, but we do prescribe pain medicines for the right patients, but we don't prescribe very much. It's a small percentage of our population that actually takes pain medication. And that's not necessarily by design, it's just the patients that we attract. We look for things that can hopefully alleviate, a significant portion of pain, with low risk, right? And pain medications are not without risk. And frankly, a lot of patients don't really want that pain medication sort of fix anymore. Whereas, just even 10 years ago, that was really, there wasn't that stigma, right? It was, I just want to go get some pain medication, right? And now it's not that. And so I would say, I think it's a valid concern by a patient. I would have that same concern. I personally am not a huge pill taker, right? I wouldn't, I had my ACL repaired a few years ago, and I didn't take any pain medication after, right? I just didn't like the feeling, didn't want to take it. But at the same time, we have patients who, they've had back surgery, they've done their physical therapy, they're 73 years old and they just need to get through the day, right? And it's reasonable to take pain medication for that. And so you try to just match the appropriate treatment with that patient. And, we're certainly not a practice that, will push pain medication, but we're available there if it's needed. Okay.
So in your field of medicine, are there some any new advancements coming across the horizon that maybe we haven't heard of? I know, in general, you've got a lot of patients we see end up having in some form some facet injections or epidurals or radiofrequency ablation. But is there something that's coming down the road that's getting some research in now?
Yeah, so quite a bit of, a lot of patients ask for regenerative medicine therapies, right, or which we call biologics-based therapies. That would be what, a lot of people call stem cells. Stem cells are almost never used, actual stem cells. But we do a lot of what we call PRP, where we take the patient's blood and we spin it down and we'll shoot it into a joint or a tendon and whatnot to help heal and reduce pain. And there's a few other varieties of those regenerative medicine therapies. We do quite a bit of that. I would say that's not new, meaning it's been that those therapies have been around a long time. But the interest in patients to get something that is sort of an alternative to traditional steroid injections and surgery and pain medications is definitely there. And the cost of those is not nearly what it used to be 10 years ago. We certainly don't charge those astronomical amounts for those sort of therapies. At the same time, patients have, especially, commercial insured patients, they might have out-of-pocket expenses, out-of-pocket max of $5,000 or an HSA for $3,000, where they can get those regenerative medicine therapies covered, in that portion of their, insurance anyway, right? So it turns into hey, I can get something I wouldn't normally get inside of insurance, get it covered under my HSA, right? And get kind of a novel sort of therapy that really works. So that, I would say, while it's not new, is definitely one of those things that patients really want right now, and makes a lot of sense. Certainly had it myself. Other things are more minimally invasive outpatient types of surgeries. Things that used to be, big surgery with large incisions and screws and rods and whatnot, right, are increasingly being done with tiny incisions as an outpatient in the surgery center in 20 to 30 minutes. Our physicians either do many of those minimally invasive surgeries, or we have spine surgeons in the practice as well who will do those if they need something a little bit more advanced. But taking herniated discs out with a little tube and a camera, fusing little areas of the spine if they're unstable through, an incision that's just a centimeter as an outpatient. Those sort of things are increasingly available every year. There's just more advancements in that.
Okay. So that's a good point too, guys. When the video's over, there'll be some information to go to their website, but there's, you kind of touched on it, but you have some other services that you offer other than just non-invasive interventional pain. You've got some surgeons within the practice as well. And I believe you're also, throughout the valley, you've got more than one surgical location, right?
Exactly, right, yeah. West Valley, East Valley, and Center as well, downtown, so where we have surgery centers, so we can do some of those stuff.
Okay, cool. So it's kind of going in a different direction. Always try to introduce the specialist and then kind of ask you a question in terms of if you had a young person coming to you that might be interested in medicine, what your recommendation is in terms of the process of getting into med school. Do you recommend med school? Do you
Absolutely
think
not. No, what insurance is doing now? No.
I know, right?
Oh my God.
No. Yeah, ask me about PT. It's very similar. They're raking you over the coals. Yeah.
So first of all, get as much exposure as you can and know if it's something that you really like. Certainly, whether it's the long road of physical therapy or the long road of getting through medical school, you don't want to invest all of that time and effort and end up in a position that you're not excited about every day, right? So make sure you spend as much time as you can, with either a physician, in a couple different locations, whatnot, and really do your homework to kind of find out, not just homework to get your good grades, but homework to find out that's the right spot for you.
Yeah. Well, sounds like you did all that too to kind of figure out what you wanted to jump into out of med school.
And take the extra time. That was part of it too. Is take the extra time. Don't feel like you got to rush into into a decision, that sort of thing.
So out of curiosity, with your med school to do that those extra residencies, is that just you were kind of volunteered to do that and the school was okay, or did you have to?
Yeah, so there are lots of different ways to do things like that to extend your school. What I did is my school, University of Minnesota, had an extra year program that was funded, where you could essentially work for one of the departments in the medical school, mm-hmm. right? But you actually got paid, right? And so you could use that as a stepping stone to do additional rotations, get paid. You actually did some work I did through the Department of Pathology, so I worked in laboratory medicine as well to get paid for that year, but also was able to rotate around through. Okay. So, but those exist, definitely. There's all sorts of different opportunities to do things like that. Research years or whatever. They just give you that extra time and you can rotate around.
Okay. Yeah. Kind of circling back to the PT realm of it. You mentioned PT within our conversation already. Is in general, are you guys you pro PT in terms of if a patient comes in? It sounds like you guys are
absolutely not. No.
We're going to end this right
now. Of course, I mean, there's no doubt that patients, especially chronic pain patients with back pain specifically. I mean, I would focus on that just because it's such a huge portion of our patient population. But those patients don't do well with one modality. They don't do well with just injections. They don't do well with just medications. They don't do well with just surgery, right? They need multiple modalities, right? They need a physical modality of some sort, right? And so easily my patients who do the best, right, are patients who engage in something we do and something you do. All right, they have to get both going. I don't know which one works better for them, and I tell them that. I don't know if it's the epidural injection or whatever that's going to work better, or if it's the physical therapy that's going to work better. But I do know that if you engage in both, you're going to do better than most people.
I wholeheartedly agree with that, because it's a lot of times patients will come in with back pain, and the acuteness of the pain or the severity of the pain is to the point where we can't do the things we need to do, and whether it be an epidural or some other type of modality from an interventional pain person that brings the pain threshold down, that allows us to be able to do the physical component that we need to do, together, it works very well. And so it's to the patients watching this, it's a model that does work. It's not just a thing that we're just trying. It's a working model, and I work with pain specialists a lot, and it helps us get patients from point A to B much quicker and with a lot less pain.
I would say one thing really frustrating for us are some of the limits that are put on the number of visits for PT and the copays that are put on PT, right?
Yeah.
Because what that does is it ends up forcing the patient back to us, right, without any intervening sort of additional physical modality, right? So they might get their epidural steroid injection, get some good relief, but then they're coming back 2.5 months later, they haven't done anything else, and now their pain is back, and they haven't done anything to sustain that relief in the interim, right?
Right.
And so just, we spend a lot of time re-engaging those patients to say, look, you got to be part of this too. I understand it's either a hassle or it's expensive or whatever, but if you want to get better, you have to re-engage at all aspects. It's not just at the beginning, it's at, after we've intervened as well. So,
yeah, that's a statement I say with patients, certainly with any kind of spinal condition. It's a work in progress, and it's a constant, low level battle that you got to keep doing the things you need to do to avoid having to see either one of us again in the future. So, all right. So, kind of a fun question that sometimes I'll finish these things with. And I'll just ask you kind of an oddball question, but if you had to battle a grizzly bear or a great white shark, which one would you do?
Definitely a grizzly bear, and not because I think I would win with either one of them, but I've been around even recently a lot of grizzly bears, it was in a safe environment. So we did a trip to Alaska this last year in the summer, and there's a national park in Alaska called Katmai National Park, and it's world renowned. It's got these falls where the grizzly bears sit on top of the falls, and the salmon run upstream and they jump up the falls, and the grizzlies sit there and they catch them, right? And so all of the photos all over the world that you see, the posters where the bears catching salmon, are taken right there, right? Well, that park, you walk in there, you have to fly in to get there, right, or boat in, but you get in there and the grizzlies are all around you, and there are no fences. They walk right by you on the paths, right? And they tell you in 100 years that the park's been open, there has never been an attack. You have your kids with you, they're walking with you along this, and there's all these grizzlies. So the first 10 minutes is a little tough. Yeah, a little tough. Yeah. Once you get over that, you get a little more comfortable being around those. So I have a little bit of extra comfort with the grizzly, I think.
Well, I agree with you. If you put me to it as well, because I think once I'm in the water, I think it's just, it would be the end.
Yeah, you don't have a chance. Yeah.
So, okay, well, thanks again for joining us. For everybody watching, thank you for watching, and there'll be some information when we're done here on how you can get in contact with both Total Sports Therapy and Advanced Spine and Pain.